There are no systems that comprehensively tell hospital staff what's been happening in the community. So for instance, a patient can have been seen by their GP the day before saying they're feeling a little unwell, and that information is probably really quite important. They've had a set of obs done perhaps, maybe prescribe something, but the next day they then present at A&E or call an ambulance, and that information isn't really available. You know, say that person's confused, it's not available to the staff in A&E, to the doctors, to the nurses, and that could be really important and valuable. Or a patient comes in with a catheter, they have no idea when it was last changed, the person might be confused, they might have an infection because of that catheter. So we're getting System 1 into the hospital as a read-only system so they can see what's been going on. When a patient comes into A&E, they've already had an assessment done, say 2 hours before in the community, and that's on there. So a doctor doesn't have to redo an assessment, or perhaps you're reducing down assessments, you're reducing down the patient time in the department because they haven't got to keep repeating information because it's already there. They might already be under the heart failure team, for instance, and they'll come in and they just need to communicate and say, could you go and, we've tweaked this medication, could you follow them up in a week? Rather than a whole new referral in, which wasn't necessary. That System 1 access again is giving the ward staff information into what might already be in place in the community, because most of the time all that we see is a discharge letter saying we've done this, and could you follow up with this, but a lot of the time they're already under these services, or they're asking a GP to do something that is already there. I'm also talking to ward staff and doctors, admin, physio, ward sisters, you know, whether we're saving 20 minutes here, 2 hours there, a whole bed day there, you're saving time because you're not duplicating referrals because you know they've already been done because you've got the system's information there. It's a better patient experience because they're not repeating information, because it benefits all of us as well as the patient, you know, the professionals and the patient.
System 1 has made life so much easier because key safe numbers is kind of a classic. Patients don't necessarily remember them, families don't want to give it to you, so we can actually get them into their own home safely. Finding equipment so I don't have to fill out forms that aren't necessary, and see what's happening in the community. Safeguarding's have been a big one as well, because sometimes they say they've got them but we get no documentation. So again, you can kind of got a base point to know what to work on and what you need to do moving forward again to allow them to go home. But I think the tasking was the best one to learn because it did make my life a lot quicker if you couldn't find it.